Do not treat one more PRP patient without a system that proves your results. When you track outcomes with precision, you're silencing the skeptics, and you build a practice that's powered by undeniable wins. I'm Dr. Ariana DeMers, the Queen of Business Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. We are cutting straight to the truth about PRP. You will track the metrics that matter so you know for certain what is working. Pain, function, imaging, and every PRP detail. Patterns start to jump out. Protocols improve. And patient results get better. This is not a paperwork issue. This is proof and a faster rise to the top. So why does documenting PRP outcomes matter? So we didn't go into medicine to guess. You are here to fix problems and help people get their lives back. Tracking outcomes makes that real. It turns, I think this works, into, here's my data. And when you can say, most of my knee arthritis patients cut their pain in half in 8 weeks, your credibility skyrockets. There's no hand waving, there's no apologizing for it not being covered. You just have evidence. And patients trust data. Your colleagues respect data. And we feel energized by data. When you see those wins stacking up, it reminds you of why you chose this path. This is not busy work. This is pride, purpose, and progress. So what to document? You have to be able to show a crystal clear story from baseline to outcome. Patient-reported outcomes like VAS, WOMAC, IKDC, quick to collect, but massively meaningful. Functional gains that matter in patients' lives. Return to sport, return to life. Imaging or exam findings that show objective change, objective positive change. And then, of course, you have to document your PRP details, volume, concentration, kit, activation, site, platelet dose. These small insights become big insights when you start to pick up patterns. And then follow-ups at set intervals so you can plan and see that trajectory and know if your patient's on trajectory or off. Any flare-ups have to be documented, adverse events, so that you know the whole picture and you can start to look at patients who may have higher risk of adverse events or higher risk of increased pain, flares. This is your evidence trail. Make sure you guard it like gold. So a lot of my colleagues, sometimes me included, are worried that this is going to slow you down. So how do you streamline that tracking practice? So you don't need extra work. You need a system that clicks into place and makes it inevitable that you can collect that data. So EMR templates that guide you through the essentials, a tech that collects those patient-reported data without nagging them. It's just what we do. A trained team that queues it up every time. Simple graphs that show progress right in front of the patient, and a registry or shared data set so that you can continue to collect data and push the field forward. And you make that workflow smooth so insights roll in while you can focus on the care, but also have that information at your fingertips. So how do you use this data, right? Numbers sitting in a chart somewhere don't mean anything. So put them to work. Upgrade your protocols based on real results. Educate your patients using your numbers that build trust immediately. Promote ethically with numbers and outcomes from real patients, real success stories. Your patients want transparency and they want the truth. And you become the doctor who measures, learns, and evolves, and can honestly tell your patients, listen, this is cutting edge science. When we know more, we keep changing how we do our protocols to keep up with the latest science, the latest outcomes. And that reputation sets you apart. Outcome tracking also protects you. It protects the patient, and it allows regenerative medicine to be pushed forward. You're not guessing, you are generating real-world evidence and leading with confidence. When you see steady improvements across your patient base, that gives you so much satisfaction, so much fulfillment, and those feelings of burnout kind of melt away. This progress is the fuel. Results are proof that you're doing it right, that your work matters. And PRP becomes a powerful tool backed by undeniable data. Please join my newsletter for strategies weekly that help you build a profitable, fulfilling orthobiologics practice. If you're ready to prove your PRP success with real data instead of guesswork, book a consultation call with me, and I can help you create a simple, effective outcome tracking system that drives clinical wins and cash-based growth. Subscribe to the channel for more. Your patients deserve the best, and so do you.